Hello, good evening, and welcome to the Ask Dr. Rita show. I'd like to know where you're joining from. So today is a very brief class. It's not a very long one. And we're talking today about the medical implication of oral sex. I'm not here to talk about whether oral sex is good or not. That's not the focus of this meeting. The focus is on the medical implication of oral sex. So, and it's going to be a short class because this is just to answer some questions around oral sex that I've gotten from quite a number of people. So, oral sex involves the stimulation of a partner's genitalia or their anus, and it is also sometimes referred to as oral intercourse. And this is a sexual activity involving the stimulation, like I said, of someone's genitalia by their mouth. So it is using the mouth, and it could be oral penile, which is fellato or what they call blowjob. It could be oral vagina, which is called cunnilingus or licking plate, as it's called in the street. It could be oral anal, which is analogous or rimming, as called in the streets. So, what are the implications of oral sex? Now, let's think about it. Oral sex puts you in contact with the skin, the body fluids of your partner, and that includes their semen, their vaginal fluids, their blood, their urine in some cases, their feces in some other cases, their breast milk, and any of which of all these can contain disease-causing viruses or bacteria. And even if you have you have an oral intercourse with someone and you decide to go and brush or you decide to go and spit it out, if the person has an infection, it will not do any good. If simple acts like shaving too close to the skin or shaving too close to the skin can lead to oral, can cause someone to pick up viruses or bacteria, how much more ingesting, those body fluids. So the implication of oral sex really is that someone can pick up bacteria, viruses, or even fungus. They can enter into the body. And these sexually transmitted infections, they can be transferred from one person to another. And let me list some of the infections that someone can pick up from oral sex. They can pick up herpes, they can pick up gonorrhea, they can pick up chlamydia, syphilis, or HPV. Now, I'm talking to you about the medical implication of oral sex. And if you're just joining in, please let me know where you're joining from. I'd like to know. You can subscribe so that you can get to know more about us. Follow us on the Ask Dr. Rita show. You can follow us on Instagram, Ask Dr. Rita show, Facebook, Twitter, but on YouTube, and turn on your notifications so that whenever we go live, you'll be able to get the link to participate. Now, I'm talking to you today about the implication of oral sex. So I've talked to you about what oral sex is and the types of oral sex that people engage in. Now, I want to focus on the human papilloma virus, because we're dealing with oral sex. And what is the implication? The implication, I told you, is that someone can pick up an infection. And there is a study from the Center for Disease Control that shows that oral sex can lead to a type of oropharyngeal cancer. It may not cause a cancer of the mouth. So, because the question that prompted this class was that, can oral sex lead to cancer of the mouth? No, it will not lead to cancer of the mouth. No, it doesn't. But it can cause oropharyngeal cancer. And it is not the oral sex itself that leads to oral pharyngeal cancer. So the oral sex, the act itself, does not give you cancer. But if the person has this virus, human papilloma virus, that is not treated, this virus will cause a mutation in the cells of the throat, back of the tongue, you see, and even to the pharynx, through the part where air passes. So it could lead to cancer if it is not treated. But if someone doesn't have this virus or does not have this infection, having oral sex would not cause them to have a cancer. So that's what I want to therefore make you understand. Now, what is human papilloma virus? This is a viral infection, and it is the most commonly the most common sexually transmitted infection. The most of all infections, HPV is the most common infection that someone can pick up, and it is easily transmitted. It can be transmitted through saliva. It can even be transmitted through sweat. It can be transmitted through physical touch. But it is mostly moved through sex or sexual activity. That is why it is called a sexually transmitted infection. Now, in fact, in the US, it was said that there are about 40 types of HPV strains, and it can spread through direct sexual contact to the genitalia, as well as to the mouth and through the throat. So when someone puts their mouth in someone's genitalia, the funny thing is this: when HPV is on someone's vagina, for instance, it may not become cancer there. When it gets to the mouth, it may cause the cells in that throat to become cancerous over a period of time. Usually, it becomes cancerous over, the person must have had that infection for over 5 or 6 years, So that's how it is. And there, like I said, there are about 40 types of HPV. Now, oral HPV is transmitted to the mouth by oral sex or by oral using a toy that someone has put in their genitalia and you put it in your mouth. That can be another means of contracting it. It can also be contracted, when the fluid gets to the person's mouth. Now, many people are exposed to HPV in their life. And it is said that 10% of the total number of people that has HPV are men, and 3.6% of women will have HPV. Now, I'm talking about oral HPV. So men are most likely to have oral human papilloma virus, while 3.6% of women may have oral human papilloma virus. Now, oral human papilloma virus is the virus that is in the mouth that was picked up from the person's genitalia. Now, usually there's treatment for it because it's a viral infection. It is treatable. It's not like the problem is that people don't know that they have it. So it's not as if the virus itself is difficult to treat. There are ways to prevent it. There are ways to prevent contracting it. There are ways to prevent transmitting it. So it is important that as someone who is engaging in oral sex, that this knowledge comes to you and that you take the right decisions to protect yourself. HPV can infect the mouth, the throat, and the pharynx, the mouth, the throat, and it can cause cancer, like I said, at the back of the throat. And this is usually from the CDC. CDC said has come to find out that 70% of the throat cancers that are being treated worldwide are as a result of oral sex, where the partner has HPV and did not know and has caused the cells of the throat to mutate. What is cancer? Cancer is actually an abnormality, abnormal formation, abnormal mutation of cells of the body. So these viruses will just go and trigger um, abnormal activities in the cells of the throat. And so that becomes, that can cause what we're dealing with at the moment. And so the truth is, like I said, it takes years, it takes quite a lot of time before it becomes cancerous. So it's not that when someone has HPV, then the next month, sometimes 20 years, sometimes 15 years, and sometimes it does not even belong, it doesn't even cause. So having HPV does not mean that the person will become cancerous. Yes, it can lead to cancer, but there are also other factors in the person's health that may be contributing to that. One thing that can be contributing to that in someone's health could be that it could be, one, their own personal lifestyle. Number two, it can also be other health conditions that they have. Also, are they prone to cancer? Do they have a family history of cancer? So all these things can cause someone to have cancer. So that the person HPV does not mean that the person would automatically have cancer, because, like I said, it takes a long time, maybe 10 years, for it to become cancerous. So if someone has HPV and did not know, and did not now have a good lifestyle, and did not now also have a family history of cancer, the person may be prone to it. So enough of me talking about the problem related to the challenges that can come from oral sex. So I'm just going to do a recap. I'd like to know, where are you watching from? I'd like to know, those of you that are online, please drop a comment. Let me know where you are watching from at this moment. See, so I'd like to know where you are watching from. Please drop your comments and let me know where you are watching from at this time. So what are the ways to mitigate the implication of oral sex? How do you mitigate the implication of oral sex? So, number one thing that you need to do, because, like I said, oral sex it could be the mouth to the penis, the mouth to the vagina, or the mouth to the anus. Now, the first thing that you need to do before you get into oral sex with anyone is to know their health status. This is for your own sake. You need to know their health status. You need to, before you engage in that level of intimacy with anyone, you need to do some tests. I'm going to list out some tests that you need to do. So these are one of the ways. If the person doesn't have HPV, you are not at risk, because that is what can make, over a period of time, can lead to cancer. So if the person doesn't have HPV, fine, apart from other infections that the person can have. Now, I want to say to you that it is not medically advisable for someone to have oral to anal sex. That is putting your tongue or your mouth in someone's anus, because those are fecal matters and they can lead to very serious systemic infection. So in engaging in oral sex, as much as possible, stay away from the anal region to protect yourself, as well as protect your partner from them, having complications that would arise from the use of their mouth, their teeth around their anal area, as well as you picking up bacteria and infections from the anal area. So one way to mitigate the possible side effects is to ensure that you know your partner very well. You run laboratory tests, do tests. I'm going to list out some of the tests for you to do. Now, so in supposing, okay, fine, we'll get to test point. Now, we're looking at number 2 point, know yourself, know your partner. Number 2, explore barrier method. Yes. Now, there are very many types of different things that you can use to choose from So you need to find out which one will work for you and your partner in your relationship, and which one will work for you. So the first barrier method I will talk about, there are two types of barrier methods that you can use. The first one is a condom, use of condom. Now, condoms are cheap, condoms are available. They have both latex and polyurethane condoms. You have to choose the one that is convenient for you. The good thing is that they are cheap, they are easily accessible, and all of that. The only thing is that to put a condom, to do oral sex with a condom around the person's genitalia, it may not give you as much pleasure as you want, number one. And then the latex, putting latex in your mouth may not be conducive, or you may not find it pleasurable. So that may be the prone of the con of using condom. Number two barrier method is what is known as dental dam. And that's what I'm going to encourage anyone that want to get into oral sex. If you use dental dam, you are protected from all types of sexually transmitted infections and other types of infections that may come from oral sex. In fact, that's part of why it was developed. So when you use this dental dam, also known as oral dam, if you just Google it, you will find it. It's not hard, and you can find it in very good supermarkets. They are called oral dam or dental dam. You wear it over the person is the one that you wear it over your mouth, and it doesn't it will not take away the pleasure, it will not take away the satisfaction, it will not take away it's much more better than latex. Now, this dental dam is designed for the mouth and is designed for oral sex. So you find out that it helps your mouth. It gets your teeth, your tongue, everything. You just wear it around your mouth and there will still be saliva. But the thing is that the person their fluid cannot infect you. That's why, just Google it. It's called oral dam or dental dam. Oral, that is your mouth. Oral dam, D-M. You see, if we can have it on the screen, oral dam is fine. And this is made and designed specifically for sex, for oral sex, to protect you. Even if the partner is infected. You have some couples, before they married, maybe they married a partner who is HIV positive, but the partner is not transmitting to them, but they're HIV positive, but they apply extra caution and care. Or some of them even have hepatitis B. They may not even know that they have those hepatitis. Some of them have some they know, sometimes they don't even know self. But whatever the case is, they have decided to stay together. This oral dam is something that you can use, and you will still enjoy yourself, as well as you will have your mind is calm that, oh, fine, I'm not going to be infected. So the only thing about oral dams is that because they have been designed for oral sex, they are not cheap like that, but it's not like they're expensive. Where maybe a condom may be like, I don't know how much a condom is, so maybe a condom is like maybe 200 or 500 or whatever amount it is sold. An oral dam may be like maybe 4,000, and it's a box. The good thing with it is a box, is a pack that is one that you can put in your mouth. You wear it. It's like a gel. You can peel it off. So you if and then there are different colors. If you're wearing like a blue or a purple color, some will not even know that there's anything in your mouth. So when you wear it, it protects your teeth, it protects your tongue, it protects everything, as well as protects the person that you are engaging in the intercourse with. So the thing is that it's a bit expensive. So how do you do it when you want to engage in oral sex? What should you do? Number one, you have to be prepared. It's not something that you just jump and say, oh, let us just experiment. Like I said, you must be ready for it. Having this knowledge that I just gave to you now, it helps you to be prepared. So have your barrier method on ground. If you want to use a condom, wear a condom. There are condoms you can use and improvise, because those are not specifically created for oral sex. You may find it a bit difficult and challenging, but for the oral dam, you find out that once you put in your mouth, it's good, and it's you find it interesting to use, and it will be easy for you. So have the correct one. Then every time you're going to engage in it, always use a barrier method. So don't say that I used it today, tomorrow, and I forgot. The purpose is to protect you. And then, like I said, before you put your mouth in someone's genitalia, know the person, know their health status, do laboratory tests, take time to do tests, investigate, don't assume. There are some infections that may not cause lifetime of problem. There are some others that become a lifetime of problem. So don't allow the heat of the moment take away the sense of reasoning to make a sound decision. Also, don't ever forget the most important person in an oral sex. You are more important because you are putting your mouth there. So you need to be sure that you are not infected. You're not you. So you check yourself regularly. Ensure that you check yourself regularly to be sure that you're not infected. Now, suppose you now get the oral dam, or how do you keep it? How do you use it? So first of all, until you are ready to use it, don't put it in your mouth. Then number two, avoid using um oil-based lubricants. You're going to use a latex. Most preferably, it's good for you to use water-based. Now, these things oil-based can be damaged, and water-based is easy. It will not be damaged. So, what are the tests to do? Suppose you want to engage into oral sex. What tests should you do? What tests should you do? First of all, for the woman, I'll talk about for the woman, I'll talk about for the man, and I'll just list them for you. You can do an HVS, MCS, that is high vaginal swab. It's a test where the swab is put into the vagina, and then it will be cultured. Whatever bacteria strain is found, it will show whether it's sensitive or not, and then the person can do. The man can do a semen MCS, it will find out if there is a bacteria, what kind of bacteria. You can do a VDR, venereal disease research laboratory test. That's a test to check for venereal diseases. You can do HPV tests too. If you just go to the hospital and tell them, go to the lab and say you want to do STI, sexually transmitted infection test, so they would run all the category of tests for you. You can also do a urine MCS, microscopy, culture, and sensitivity. Sensitivity, it will tell you what are you sensitive to. It will tell you is it gonorrhea, is it staphylococcus, is it enterococcus. Now you see, in the benefit of running these tests is that when you get this knowledge, you can then now make a decision, you see, that you can use to protect yourself with the knowledge. Do you understand what I'm saying? Now, what are the most common types of sexually transmitted infections that someone can have? And I'm rounding off already because, like I said, this is a very short class. It's not even going to be up to an hour, except I have some questions. But if I don't have any question, then it's just going to be like an hour, about like 30, 40 minutes session. Now, what are the most common types of sexually transmitted infection that someone can have? Number one can be chlamydia. Chlamydia is sexually transmittable. That means a woman can give a man can give a woman. The thing with chlamydia is that chlamydia produces a kind of a yellowish discharge in the woman, and sometimes may not even produce any symptom at all. Now, I want you to refer to the videos that I did on infection. They're right here on this page. You can find quite a number of them there. So you check out chlamydia, genital herpes, genital warts. Warts are usually as a result of some strains of human papilloma virus. So you want to check for genital warts. You want to check for gonorrhea. It's also called a clap test. You want to check for hepatitis B, hepatitis C, or hepatitis A, but most likely hepatitis B. You want to check if the person has HIV or AIDS, very important. You want to check if the person has HPV. These are tests. You also want to find out, does this person have pubic lice? It's very important. Don't go and put your mouth in someone's genital area and they have lice. It's not in your advantage. Then you want to check for syphilis, you want to check for trichomoniasis. And then if the person has vaginitis, like I talked last month, I talked about vaginitis, which is an inflammation of the vagina. It is not a sexually transmitted infection, or if it's not caused by a bacterial infection. A bacteria can cause the person to have inflammation of the vagina, but vaginitis itself is an inflammation of the vagina, and it can be caused by several factors. And one could be estrogen abnormalities. Also, it could be as a result of menopause. So that is not sexually transmitted, but it can also be caused when it's caused by either a fungus, a virus, or a bacteria. Then it could now you understand that vaginitis can lead to sexually transmitted infection. So what should you do if you're not very sure what else to do? If maybe you have observed that you are experiencing some itches around your penis, or you're having some burning sensations, or you are having some discharge, or you are feeling pain. So these are some signs of infection. Sometimes some infection for a man may not have a discharge. They may have pus. They may find some pus at the tip of the penis, usually maybe at wake up, or at or after a while, after a long day, they take up their boxer, they find a lot of stains and all that. It may be smelly, it may not be smelly. But most of the time, for a man, the man will experience that he has sores around the penis, sores at the base, at the scrotum. He may be experiencing a lot of itching, a lot of intense itching, irritation of the skin around that. There may be sore on the around the genitalia for the man, and then the man can be experiencing pain during urination, pain after urination, difficulty in urination. Infections can cause that, and if it's not well taken care of, it can lead to a condition known as prostatitis, which is known as inflammation of the prostate. So if as a man, it's very important that you are not joking with yourself. And if you're not sure, you can reach out to me. The number is on the screen. Please reach out to the number and schedule a consultation session. You can do a 15 minutes consultation. You can do a 30 minutes consultation. You can do a 1 hour consultation for us to be able to examine you and find out. And in case you have been battling with some form of infection, reach out to me, because when you are dealing with infection, like I said, I was live last week and I was saying that in dealing with infection, it is important that you break the cycle. So I was talking to you about if you have an infection with the if you have an infection. Oh wow, thank you, Iboro Aqua from Akwa Ibom State. Thank you. I hope you are learning. I hope you're finding it interesting. Um, Thank you so much. Thank you so much. Thank you so much. All right, so you can drop your questions. So I said, if you are battling with, as a man, I was talking about the man. If you are battling with some form of infection, you're not very sure if you have an infection, or you are not even sure what test to do. I listed the test to do, or you have even done tests, or you are even experiencing some of these symptoms. Sometimes I was talking to you about prostatitis, and I said for a man, it can lead to infection not well treated, can cause the prostate gland to enlarge, leading to prostatitis. And if it doesn't get resolved on time, can lead to benign prostate hyperplasia, can cause the cells to become enlarged more than normal. So infection is not something that a man should joke with. Don't joke with it. Reach out to us. We have a special package for infection that can deal with infection for man. We also have the one that can deal with infections for woman. And these formulations have been put together for sexually transmitted infections. You see, so it's important that you do this thing. Now, also for the woman, if she has an infection, what are the signs? Sometimes it may not lead to any sign. And for the man also, infections can affect fertility. It may make them to have watery sperm. It may make them to have quick ejaculation. It may even make them to have have low sperm counts. So it's important that you are healthy, whether you want to still have a child or you don't want to have a child. It's just good that you are at the best of your performance. Now, for the woman, let's move for the woman. If a woman has an infection, how is she going to know? She may have some itching, she may have some pain, burning sensation, she may feel pain during intercourse or pain after intercourse, she may feel bleeding in between her period, she may also experience itching, intense itching, she may or may not have a vaginal discharge, depending on what it is that she's infected with. If it's like gonorrhea, it may be greenish. If it's like trichomonas, it may be a bit yellowish. It may have bad odor. You can have fish smell. It can have frothy smell. It can have like an alcohol smell. It can be like a cheese. These are some of the signs that someone has an infection. And sometimes there may not even be any sign. Sometimes some of these bacteria, they just come in and they ascend from the place of infection, ascend upward, then bigger problem. For a woman, it can lead to a condition known as pelvic inflammatory disease. It can also lead to infertility, secondary or primary infertility. So you don't want to put yourself in a position where you are not protected. So if you want to engage in oral sex, it's very important that, like I said, take protection. Get the oral dam. It's not expensive. I don't think it's more than 3,000 or 4,000 for the box. And the box has, I think, about 10 or 20 of it in it, depending on what you get. And it's easy. Just wear it in your mouth, and then it can protect you, from contracting those infections and protecting your mouth and your throat, And then if you find out that you have an infection, please treat it. You can reach out to me. I'm always available. The phone number is right there on the screen. Please can the phone number be on the screen so that they can reach us, and let the phone number be there permanently so that they can know what actions to take. So I have a question that someone asked me, and the person said, I'm going to read it out to you. The person asked me a question. The person said, hello, Dr. Rita. I have this question. I'm trying to scroll through it because it's been a while. Okay, the person said, hello, Dr. Rita. I have this prolonged infection that refused to finish. Yet the result says that the husband does not have. Is it possible for the woman to have infection and having sex with the husband, and the husband will not have the infection? This infection has lasted for 28 years. Now, this is a very dangerous place for this woman to be. To have an infection that has lasted for 28 years is a lot of serious problem. If this woman has some strain of HPV, by now it would have almost been forming some form of cancer of the vagina or what around those areas. But I don't have more details about what kind of infection that she has. But I want to say that for the woman, now there are different types of infection, like I said. There are communicable and there are non-communicable infection. There are infections that via sexual penetration, the man may not pick it up. But via oral sex, the man may pick it up, pick those bacteria. Yes. And yes, it's possible for someone to have an infection and the husband would not have an infection. Yes, it's very possible. Yes, it is possible, because not all the kind of infection that someone has. For instance, if a woman has yeast, yes, the man can pick up that fungus infection through their mouth, but may not pick it up during sex. Even though some people have picked up, but it's not considered a sexually transmitted infection like you will have gonorrhea and all that. You see, so, and then also too, sometimes a woman has a condition known as bacterial vaginosis. Bacterial vaginosis is a condition where the bacterial load in the female's vagina is more than normal. And there are several factors that can contribute to that or that can cause that for the woman. And so when the woman has that condition, she would be feeling the symptoms of the infection. She'll be dealing with the infection, but the husband will not be dealing with that infection. So yes, madam, it's possible. And I am suspecting that you are having bacterial vaginosis. And if you're having bacterial vaginosis, there are lifestyles and there are things that you need to do to protect yourself. So I would say to you that you should please reach out to us, reach out to us and let us get to help you with the bacterial infection. So I'm done with my slide. I said it that I was going to not spend more than 30 minutes. If not for the questions, I think I would have finished answering. So if you have any question, you can drop it. But if no question, then I'm going to be rounding off from the session now. I want to thank you so much for logging in. My name is Dr. Rita Jabin. I'm a naturopathic doctor, and one of my passion is to educating people on how to live healthy life. So I teach you how to stay. I get you well through my treatment, and I teach you how to stay well through my live sessions and through my videos. I encourage you to follow me. I encourage you to follow me on Instagram. Every day I have a different topic. In this month of April, we're dealing with the digestive system, and we talked a lot about the mouth and things to do, home remedies. We talked about bleeding gum. We talked about, different things. Next month, we're going to be moving into the immune system. We're going to be talking about how to prevent allergic reactions or allergic diseases as a result of immune imbalance. So it's not something you want to miss. So I want you to stay with me. I want you to follow me, and I want you to tell your friends about the live programs. And I will see you at my next live show, which will be coming up in the month of May. In the second month of May, we're going to be going live on a Saturday. As we deal with, for that one, we're going to be dealing with immune disorders. You don't want to miss it. You're going to learn a lot, and you're going to learn the things that you're going to do to prevent immune disorders, as well as for yourself and for your children. Until next time, stay well, live well. Remember, you have one life, and live it well.